The NHS is in the midst of the biggest challenge in its history. With a workforce crisis and a growing backlog, the health service faces a difficult future, tasked with doing more with less. Despite this, some hospitals are rising to the challenge. The Medical Technology Group's latest report found that hospitals, such as the one here in Wakefield, were treating up to 3 times as many patients as others. Why is this the case? For Chief Executive Len Richards, a simple piece of innovation known as the Shared Referral Pathway that allows primary and secondary care clinicians to communicate about a patient before they enter the hospital has been vital to the Trust's success.
Shared Referral Pathway is a really important development here within Mid-Yorkshire. The reason for that importance is it's a demonstration of system working, so general practice, community services, staff within the hospital working together in the best interests of patients and recognising that patients should only ever come to a hospital if that's what they require.
For GP Clive Harries, the pathway has transformed its practice, providing access to specialist consultants in primary care, which has led to fewer referrals and even the earlier detection of cancers.
I can give a good example of how the Shared Referral Pathway has helped the care of one of my elderly patients. I had arranged a CT scan which showed an incidental finding in his bladder, which wasn't of any immediate concern. He didn't have any symptoms. However, he did have a history of bladder cancer. So I asked a question of my consultant urology colleagues via the Shared Referral Pathway. They responded to that question within days to say they were also concerned about the finding, given his history of bladder cancer. They arranged to look inside his bladder, saw something of concern, and he had treatment for what was a recurrence of his bladder cancer much sooner than he perhaps would have done otherwise.
So big breath in, fine.
The pathway has also relieved the pressure on clinicians like Dr. Nigel Artis, a consultant cardiologist who has benefited from a 60% reduction in GP referrals.
The benefit of this pathway is that secondary care physicians, the experts in those areas, are determining who needs to come to hospital. The old system essentially relied on GPs sending their questions when they didn't know the answer or wanted some support in some way, and we had no way of looking in depth at that patient. So we had no way of deciding if we needed to see them, and our only option essentially was to bring them all up. What I think we do quite often in the NHS is underestimate the harm and anxiety and emotional distress that waiting causes on our patients. And I think this allows us to get an answer quickly back to the GP, typically within 24 or 48 hours, and that can then be sent on to the patient that actually these symptoms are benign. If there's something sinister, it also allows us then to bring those patients in. And we've seen the other end of the spectrum where we'll get sent some information on a Monday morning. We bring the patient up to the ward that afternoon because there's something that sounds particularly concerning to us. And we've admitted patients literally 6-8 hours after the GP's asked the question, sometimes with life-threatening and life-changing consequences. So it allows us to properly prioritise the patients that need to come, and it allows us to properly reassure those patients that don't need to be in here, don't need to be waiting on our waiting lists.
System 1, the technology used to create the pathway, is used by most NHS trusts to record vaccinations. But the pathway built here in Wakefield is unique, relying on collaboration across the trust to bring it to patients, a process which Jackie Tatterton, Head of Transformation, says hasn't been easy.
With transformation, there's so many historical processes and beliefs that are set in stone within the NHS, and to truly transform the NHS, and we have to change the ways we work, we have to change the culture, we have to work together differently, we have to work outside of our existing silos and within the 4 walls of whatever organisation we work in, because a patient at the end of the day doesn't see us as different parts of the NHS, they see us as the NHS.
Having looked at the issue and developed a solution, the team in Wakefield is now keen to share what it has learned with others. The Medical Technology Group wants to see this new approach and other examples of innovation in its latest reports adopted across the NHS. Sharing and implementing what works well in one hospital across the NHS is key, not just to ending regional variation, but building a model of care fit for the future.